Hi everybody, I'm Jen Hale with Thibodaux Regional Medical Center, and today we're discussing a very common breathing problem called COPD. Dr. David Patten, a native of Baton Rouge who did his training at the University of Utah and at Tulane, is going to fill us in. Dr. Patten, thank you for your time. We know that COPD is a condition that affects people's breathing, but can you fill us in on what's happening with the lungs, what's affecting them?
Sure, Jan. Thank you for inviting me. COPD, or chronic obstructive pulmonary disease, is a disease that people typically get from smoking. Now, it's not just from smoking, it's associated with that, but there can be any number of noxious fumes that you can be exposed to, welders, coal miners, and sometimes you're not even exposed to anything. There are genetic forms of COPD. COPD is characterized by a chronic inflammation of the lungs that leads to airflow limitation. So an inability to move that air in and out of the lungs well.
Correct me if I'm wrong, COPD is both treatable and preventable to some extent. What is Thibodaux Regional Medical Center doing to help people prevent and treat COPD?
Well, we're attacking it from several different angles. One of the most important things that we can do is educate. Both educate those who have COPD. Sometimes patients don't realize that they have it. They may have smoked and maybe quit 20 years ago, and often the case, a patient will tell me, well, I quit 20 years ago, how can I have COPD now? Well, the inflammatory process that was kicked off from the smoking continues and can lead to further decline in your lung function if it's not taken care of now. There's also educating those and preventing COPD from ever happening, getting people to quit smoking when they can. Medical care is more like a partnership with the patient. We want the patient to live happy, full lives, being able to do what they want to be able to do, be able to enjoy life. And so giving them the tools, the knowledge they need to be able to do that is important.
Dr. Patten, are there any types of physical exercises or maybe breathing techniques that patients can try to increase their lung function?
Certainly. Exercise is always recommended, and it's one of the best things that you can do. We recommend that you start off with something that's low impact, nothing too rigorous, maybe just walking. And you walk and you get short of breath, and when you do, you should stop and rest and then try again. Exercise has been shown to improve things across the board. It improves function, it improves quality of life, it makes patients happier. As far as breathing techniques, there's pursed lip breathing, and there's breathing so that you better utilize the diaphragm. I would say that before you get into those things, it's better to consult with your physician or respiratory therapist.
And Thibodaux Regional Medical Center has several waiting to stand by and help.
We sure do.
Dr. David Patten, thank you so much for your expertise and your time today.
You're welcome.
And thank you so much for tuning in.